to me, a lot of medicine is talking to people about their backgrounds and what do they really enjoy in life. And that's a huge range, right? Some people it's being on, professional soccer field or something like that. And for other people, it's just hiking or playing with their grandkids. So for me, there's a story behind every one of those knees and hips. And I really enjoy most about medicine what that story is and how we can work together to get them back to those activities that mean the most to them in their lives. So I think I have the most classic orthopedic story, like everyone else, is just playing, growing up playing every sport, suffered a few orthopedic injuries, tore my ACL, broke my ankle. I really had no radar for orthopedics or even medicine at that point. After working with some great orthopedists, getting back on the field, was completely inspired by how much they had given me back quality of life by doing those surgeries. And I thought, wow, this is a pretty amazing field and you're definitely changed my life. That really motivated me to seek out more medicine and look into orthopedics specifically, and I ran with that. To be able to sit down in the office, show someone their imaging and say, hey, this is really what's causing your pain, I think there's something very powerful. I work mostly in total joint replacement, so for me that's total knee replacement and total hip replacement. Kind of within that field, I've really dedicated a lot of time to learning minimally invasive, what's called anterior total hip replacement. So a hip replacement from the front using kind of a specialized operating room table and an x-ray to make sure we can kind of put the components in exactly where we think is optimal. And then on the knee side, I specialize in both manual and robotic knee replacement. So essentially using a robot to help us exactly dial in where we want those components to be. On top of that, any complex revision work, so any hip replacement that kind of has been in there for 20 years and needs a revision, or same with the knee replacement, focusing on revising those components in the best way that we know how to. You're bringing together an amazing array of physicians. So you have this existing network affiliated with Brown, these incredible world-class physicians here that have an awesome name, and we're kind of expanding that territory to Southern Massachusetts and other areas. So I'm being able to collaborate every week with these guys who have been doing this for so long, and the tutelage and leadership here, I think it puts us in a position to treat patients the best possible that we can. That really includes both state-of-the-art opportunities for doing surgery, but also keeping up to date with all the latest knowledge and combining this real research-oriented academic powerhouse with the more clinical side of surgery and seeing patients. To see people just walking out of the surgery center the same day and really saying, I wish I had done this earlier, that's a really powerful tool and an ability to change someone's life.